starting with thinking, extrovert thinking is basically getting at making decisions based on how can it bring something practical for your for the environment around you, for the people around you, get immediate results for other people. So how much do you find yourself engaging in tasks that prompt you to get immediate results for people around you and make the workflow run smoothly, efficiently, effectively?
Yeah, very often. The examples of that extrovert thinking that you were describing, I see that very often in my practice, not only in the clinical side, but, again, as I was saying, in terms of office management, having an effective team, having a patient efficiently move through your clinic. You have to have some leadership and be hands-on with staff and kind of help guide, a lot of the actions to get the best outcome and the best approach. If something is not working, you have to be able to identify it sooner rather than later, so that you can make an immediate impact, hopefully for the better. Certainly in terms of GI, going back to the GI bleed, I mean, that's an immediate need.
Yeah.
And if what you are doing is not working, you have to take a step back and globally look at the patient, certainly what's in front of you, what's on your camera, what's on your, what your scope is showing you, but what are those patients' vital signs? How is he or she responding to the maneuver that you just did? Do you really have control of the scenario? Do you need to, swiftly take a different approach? So these are like immediate decision-making things that, you have to wire yourself to think that way.
Yeah, it's like a good mix of kind of what we talked about earlier with the extrovert sensing, being attuned to spontaneous things in reality, and then making decisions based on that, those sporadic things that are thrown at you to, ensure the most effective outcome in the moment. Mm-hmm. How often do you need to engage in more of a reflective, like understanding the logic, the mechanism, like, the mechanism of action, for example, like, I guess is the best example, like, to put it, like, understanding why something happened the way it did. Because, some professions, it seems like it's just, knowing why is important, but at the end of the day, your job is to just, treat and move on. But then there are other professions where it's like, you got to understand why this happened and really get at the diagnostic, pathophysiology as to why it happened before you can just throw treatments at them. So how often do you find yourself engaging in that sort of approach? Like, how often are you required to understand why something happened, as opposed to just what to do with it, basically, like understanding the why?
Yeah, so you're getting at what we sometimes refer to as after action review.
Yeah.
And, I wish that we had more time to engage in that. The nature of what I do often requires that immediate intervention. I mean, that's just the reality of a GI bleed or a foreign body lodged in someone's esophagus or some sort of acute obstruction that, you have to address real time immediately. Mm-hmm. Feels like maybe pathology or that sort of thing, where you're doing autopsies and you can really kind of delve into the weeds of the why. Those scenarios probably provide for more time to do that sort of assessment. In my field, before you know it, your pager or cell phone is blowing up for the next bleeder or, the next case. It just depends upon the type of practice that you have. If it's more of a hospital-based, emergency critically ill type scenario, unfortunately, you don't have the luxury of all that time. If it's more of a clinic-based elective procedure sort of thing, then, you have that wherewithal and time to kind of do that sort of assessment and sort of after action review as to the why, and, mechanisms of action and the like. I have a mixed practice, but, I would say that most of it has to do with the more immediate thinking and intervention, those needs.
Gotcha. Yeah.
And because those situations often are quite dramatic, they tend to stick with you more.
Right.
Particularly if there aren't good outcomes. These are things that, you know, you take home with you. And in your personal time, when you're trying to decompress and so forth, that's often when I find myself working through that, doing that after action review. And you have to do that. Otherwise you go crazy. So you have to, you know, decompress and work through things, figure out what went right, what went wrong, what do you do well, what might need to be adjusted so that, you know, you can be fulfilled and you can sleep at night.
For sure.
You want to do the best you can for your patients, but you want to be able to provide a brand of medicine that, you know, you're proud of, that your family's proud of. You want to be able to look yourself in the mirror at night. And in order to do that, you have to do at some point that introspection and that review.
For sure. Yeah.
But unfortunately, we don't have a lot of time, you know, in the work day, so to speak, to do that.
Yeah, that kind of segues into the last two things in this cognitive function stack, which are the extrovert and introvert feelings. So like this is about doing extrovert feeling, doing work that will make other people happy, whether it's your family or your colleagues or friends or whatever, or that your patients happy. And an introvert feeling is about doing stuff that will, you know, make you happy. So how much of the things that you do in your field involve like being attuned to what makes other people happy, making sure that you're getting not just their medical needs met, but also their emotional needs met. If there's a lot of emotional ties into, you know, the illnesses that go on.
Sure. Yeah. And, you know, as a clinician, you're wearing many hats. I mean, you're not just, you know, someone who's introducing that scope or that, you know, doing that procedure. I mean, people come to you with a lot.
Sure.
And when they're sitting in your office, you know, they're looking at you in a certain way and they are wanting to unload. They come with their chief complaint, as we call it. But, you know, often the conversations delve well beyond things that are, you know, that are relevant to GI. And so listening, letting the patient talk and really trying to connect with, you know, what their concerns are and what their needs are. Even if it delves beyond, you know, your specific field, I think what I try to do is allow space for, you know, that connection, right? Because if you don't have that connection or that trust, you know, it does not make for an optimal physician-patient relationship. And you're trying to build a relationship, a partnership. You know, that you can maintain over the years, where the two of you are working to, you know, preserve health if they're doing well, or if they take a turn for the worse, bring them, you know, right the ship and bring them back. But they have to have some faith and confidence in you. In order to build that faith and confidence, you have to listen. You have to let them decompress. You have to know what their interests are. You know, their grandbaby just graduated high school or, you know, whatever. You know, get in touch with their joys, their needs, their emotions, their highs, their lows, because it just builds the trust.
For sure. Yeah. You can't neglect them.
Now, will that help me take a polyp out? You know, I don't know. Who knows? Maybe. I mean, I might not be thinking about that at that time, but, you know, I'm motivated to do my best.
Yeah.
You know, I care. So.
Because that's basically, you know, not neglecting the feeling, the emotional component of it. Like, yes, we have the thinking side, you know, do what you need to do to get the results, effective, immediate action. And then also doing the introvert, introspective thinking of, you know, why something happened. But you can't neglect, you know, the emotional component and the feelings of it. Like, you gotta, like what a lot of people say, which is, but it's, you know, it's not something
we do ourselves a disservice if we do that. I mean, you know, they tell you don't get too attached. It's impossible.
Yeah.
It's impossible not to get attached or invested to some degree. And if you're not, then you probably shouldn't be doing it in the first place. There are too many other ways you can make a living out there. And whatever it is, if you are committing your life's work to that, and so much time and energy and effort, and, you know, so much sacrifice of who you are to achieve it, you better like it and you better be invested. Otherwise, it's just not a fulfilling journey. Find something else to do.
Exactly. that speaks to the last thing, that what they call introvert feeling, doing something that makes you happy. So finding your own personal passion and fulfillment in the thing that you're doing, not just doing it because you want to get some other external benefit, but it's not something you enjoy doing. Yeah,
Right.
you gotta have a balance of like everything. Like, yes, you're doing it to like serve other people and like do, you know, for whatever reasons that you could be doing it, but you also have to be emotionally invested in it too, and actually personally like enjoy it too.
That's true. And there, as always, though, there's balance there.
Of course, yeah, balance
Because you also have to be resilient, and you have to have some things built into your life to decompress and relax, and that are outside of, and in this case, medicine. Other things that give you joy and fulfillment, and just allow you to kind of rejuvenate and reset, or so that you can be your best self.
And how well would you say your field, or just the field of GI in general, allows for that sort of thing? Like, how flexible are, I guess, the work hours and everything?
Listen, the onus is on you, the provider.
Yeah.
Because medicine, if you let it, it will chew you up and spit you out. The machine, the beat goes on, and you can sometimes be a cog in that wheel and get lost in it if you allow yourself. But that's why I think exercises like this, where you are doing self-assessment and taking a look at values and what motivates you, and all those sorts of things, are so important, because it helps just make you a more complete, honest person, and that translates to how you practice medicine. So be invested, of course, but also have some mechanisms to decompress, and have some other avenues of life that give you some fulfillment and purpose and meaning.
For sure.